So, did you know that one of the most common complications after surgery can begin within just few hours, and many patients don't even realize it's happening? Now, as a nurse, I've seen patients recover well after surgery only to develop breathing problems that could have been prevented. Today, we are talking about atelectasis. What is it? Why it happens? And the simple things that can dramatically reduce the risk. So, what is atelectasis? Now, imagine a balloon that isn't fully inflated. That is essentially what happens in atelectasis. Atelectasis occurs when the small air sacs in your lungs, that's the alveoli, partially collapse. And when this happens, the lungs can't exchange oxygen effectively, making it very hard for the body to get the necessary oxygen it needs. Now, after surgery, this can happen surprisingly very quickly, sometimes within hours. Many patients do think that they can rest in bed after surgery. But guess what? Prolonged bed rest can actually increase your risk for lung complications. So, why does atelectasis even happen after surgery? It's due to several reasons. We'll say a few of them. First is anesthesia. Anesthesia causes you to take shallow breathing or shallow breath. Second is pain from the surgical incision, because most of the times this prevents patients from taking deep breath and also coughing. And thirdly is staying in bed for a long period. This means the lower part of the lungs doesn't expand fully. Now, these factors together allow portions of the lungs to collapse. Now, as a nurse, a new grad nurse, if you get a post-op patient, watch out for these things because that could be something happening. Are they having shortness of breath all of a sudden? Low oxygen levels, increased respiratory rate or increased work of breathing, difficulty taking deep breath, and even sometimes fever. Because if this is left untreated, atelectasis can increase the risk of pneumonia. 3 ways to prevent atelectasis. 1. Encourage deep breathing exercises for your patients. Actually, it's one of the simplest but most effective methods. Every few hours, encourage your patient to take slow deep breath and also hold each breath for at least few seconds before exhaling, because this helps reopen the collapsed lung sacs and also improve oxygenation. And many hospitals usually provide incentive spirometers, and this device encourages patients or helps patients to take in deep breaths and also gives them visual feedback. 2. Early ambulation. Getting out of bed and walking as soon as it is safe is the most and best interventions. Because guess what? Walking helps expand the lungs, improve circulation, reduce the risk of blood clots, and also promote bowel function. Many patients do think that nurses are being tough when they encourage them to start walking right after surgery or something. But the reality is we are actually helping prevent serious complications. 3. Coughing and repositioning. Changing position frequently and coughing helps clear secretions that can build up after surgery. So you always want to encourage your patient to splint the incision sites with a pillow before they make any coughing, or before they cough, because this makes it a bit more comfortable. Now, the good news is that atelectasis is often preventable. So, remember these 3 key points. As a nurse, you need to encourage your patient to do deep breathing, encourage early ambulation, and regular coughing and position changes. So now, to my patients. The next time a nurse asks you to get out of bed after surgery, remember, it's not to make your life difficult. It's because those few steps could prevent one of the most common post-op complications. And if you're a nurse, a nursing student, or a healthcare professional, now comment below. What are the most common post-op complications you've encountered in your practice? And please don't forget to like, subscribe, and follow for more nursing education content. My YouTube channel is Med Surg Decoded RN, where we make things very simple. Okay? Thank you.